Andre Maybe, and I'm a senior student nurse from BSN 12. So for today's video, I will be performing the assessment of the abdomen. So let's start.
As the client urinates, since an empty bladder makes the assessment more comfortable.
Okay na po ba kayo sa temperature?
Ensure that the room is warm since the client will be exposed.
Yung abdomen yung parang po sa assessment. Yes. Okay.
Assemble all the necessary equipment such as examining light, tape measure, skin marking pen, and stethoscope.
Good day, Ma'am. I'm Nurse Andrea, and I will be assessing your abdomen. Para po malaman po natin kung meron po tayong mga
explain to the client what you're going to do, why is it necessary, and how the client can participate. Discuss how the results will be used in planning further care or treatments. Perform hand hygiene and observe other appropriate infection prevention procedures, and also provide for client's privacy. Inquire if the client has any history of the following: incidence of abdominal pain, its location, onset, sequence, and chronology, its quality, patient-associated symptoms such as nausea, vomiting, and diarrhea, incidence of constipation or diarrhea, change in appetite, specific signs and symptoms such as heartburn and previous problems and treatment such as stomach ulcer, gallbladder surgery, and history of jaundice.
Sumusuka po ba kayo minsan? Yung pagsuka niyo po ba may kasama po ba itong dugo? Previous problems and treatments po. Stomach ulcer, gallbladder surgery po. And history po ng jaundice, yung paninilo po ng balat niya.
Assist the client to a supine position, with the arms placed comfortably at the sides. Place small pillow beneath the knees and the head to reduce tension in the abdominal muscles. Expose the client abdomen only, from the chest line to the pubic area to avoid chilling and shivering, which can tense the abdominal muscles.
Check po natin yung skin integrity niyo po.
Inspect the abdomen for skin integrity. Then, inspect the abdomen for contour and symmetry. Observe the abdominal contour. Ask the client to take a deep breath and to hold it. Assess the symmetry if contour while standing at the foot of the bed. If this tension is present, measure the abdominal girth by placing a tape around the abdomen at the level of the umbilicus. If girth will be measured repeatedly, use a skin marking pen to outline the upper and lower margins of the tape placement for consistency of future measurements. Observe abdominal movements associated with respiration, peristalsis, and aortic pulsations. Auscultate the abdomen for bowel sounds, vascular sounds, and peritoneal friction rubs. Warm the hands and the stethoscope. For bowel sounds, use the flat disc diaphragm. As when the client last ate from 4 to 7 hours after a meal, place the diaphragm of the stethoscope in each of the 4 quadrants of the abdomen. Listen for active bowel sounds. Irregular gargling noises occurring every 5 to 20 seconds. The duration of a single sound may range from less than single to more than several seconds. For vascular sounds, use the ball of the stethoscope over the aorta, renal arteries, iliac arteries, and femoral arteries. And listen for bruits. For peritoneal friction rubs, these are rough, grating sounds like 2 pieces of leather rubbing together. Remember that friction rubs may be caused by inflammation, infection, or abnormal growths. Percuss several areas in each of the 4 quadrants to determine the presence of tympany, sound indicating gas in stomach and intestines, and dullness, decreased absence or flatness of resonance over solid masses or fluid. Use a systemic pattern, begin in the lower right quadrant, proceed to the upper right quadrant, the upper left quadrant, and the lower left quadrant. Perform light palpation first to detect areas of tenderness or muscle guarding. Systematically explore all 4 quadrants. Ensure that the client position is appropriate for relaxation of the abdominal muscles and warm the hands. For light palpation, hold the palm of your hand slightly above the client's abdomen with your fingers parallel to the abdomen. Depress the abdominal wall lightly, about 1 cm to the depth of the subcutaneous tissue with the pads of your fingers. Move the finger pads in a slight circular motion. Note areas of tenderness of superficial pain, masses, and muscle guarding. To determine areas of tenderness, ask the client to tell you about them and watch for changes in the client's facial expression. If the client is excessively ticklish, begin by pressing your hand on top of the client's hand while pressing lightly. Then slide your hand off the client's and onto the abdomen to continue the examination. Palpation of the bladder. Palpate the area above the pubic symphysis if the client's history indicates possible urinary retention.
abdomen niyo po kanina. Meron po ba kayong naramdaman na kahit anong masakit po? Wala. Okay po. So, it means po na regular naman po or normal naman po yung urinary niyo. Wala naman po problem po sa pag-ihi niyo po and then sa bladder niyo po. Ayun po. Thank you po.
Lastly, document findings in the client record using printed or electronic forms or checklists supplemented by narrative notes when appropriate.
So that's how you assess the abdomen. I hope you learned something and thank you.